This hospital is a growing, vibrant academic medical center. I think of it as a three-legged stool of the mission of clinical care academics and then scholarly activity or research.
CHI Health is the largest health system in the region. In addition to that, CHI Health is part of the largest faith-based health system in the country, Common Spirit Health. And that brings us an advantage. Our physicians and our nursing staff, they can learn from each other and improve the care that we're able to deliver from Kearney to Corning.
Cardiovascular services are so needed by the community. Most types of heart or cardiac or vascular issues are increasing in our population in terms of incidence, and so we want to be available and always on the cutting edge with what's new and what the community is going to need. Our team here has established over the last few years a tremendously strong foundation for the basics, but also those advanced services.
So the Heart Institute is a collection of physicians, providers, ancillary staff that's spread out across the state. It's a care delivery model, in essence, for providing cardiology care across the state of Nebraska, southwest Iowa, and northern Kansas.
What we have been doing is bring together all the great minds to provide the best quality care for our patients. They are to perform research at a national level, and then the Institute also has the mission or goal of providing education for our cardiovascular care providers. The Institute wants to provide the highest quality care for its patients. And so it made sure that when it developed an ICU, we said, what is it that would be best for patients? We had the patient at the center of everything we did when we built the unit. And what that means is that when a patient comes to CUMC Bergan Mercy, the patient gets to stay in one location, in one room, from the entire beginning of their process to their discharge. We bring care to you universally, depending on whether you are mildly sick, whether you're moderately sick, or whether you're critically ill, rather than you having to move to another unit or another floor.
We're excited about it. We've been excited about it for over a decade. These brand new rooms take it to the next level. It just perpetuates that model that we already felt was important. Making the rooms larger also will help us to deliver more advanced care for our advanced heart failure program for patients that might be very sick, that might need some sort of mechanical support to their heart. In addition, we're expanding our advanced heart failure program to provide more and better care to patients with heart failure. Changes have been tremendous, and that's one of the really interesting things about cardiology is it doesn't stand still. There's so many more things that we could do for patients now that we couldn't do 25 years ago, and even more so than we could do, say, 40 years ago. So there's tremendous scientific and technical advances that have been made that allows us to treat patients better, safer, more effectively, less invasively. We've pioneered some of these newer technological procedures. We've been doing these TAVR procedures, the aortic valve replacements without surgery for a decade or more. We've been doing mitral valve procedure that also doesn't require surgery. We're doing these new left atrial appendage occlusion procedures that reduces patients' risk of stroke who have atrial fibrillation without having to take blood thinners. All of those things we've been on the forefront of doing, and we have high volume operators with great outcomes. So we're recognized as a national leader. We see growth in cardiology in a few areas right now. One of them is in structural heart. That's the less invasive valve surgeries, the stroke prevention, the closing holes in the heart, those types of things. The other area of growth that we're focusing on is patients with advanced heart failure, patients' hearts who are very weak, they can't pump enough blood to their body. We've been recruiting physicians into that program, and these new rooms are going to be ideally suited for providing that kind of care to our patients. Taking care of people's hearts is so important because if your heart isn't working well, there are so many other things that can go wrong. We have the ability in heart disease to make somebody's quality of life better as well as their quantity of life.
These are life-changing interventions that our providers are doing for these patients. Cardiovascular services is one of the most impactful service lines that we have on quality of life. We have a great foundation for excellence here, and as we build new programs, really fostering them not only to serve the basics in the program, but to get to a level of health system excellence and then also industry excellence.